On this Columbia morning at KFRU, we're fortunate to be able to do an interview at a time we don't normally do one, but this is a good time, especially for those of you who are just starting your day and week, to get you caught up to date with something that is in the news every day, it seems like, over the last several weeks, and that is the coronavirus. An infectious disease expert from MU Healthcare is going to join us right now. It's Dr. Hari Regunath, and he joins us by phone. Doctor, good morning. How are you today, sir?
I am very good, David. How about yourself?
Let's catch up to date on this. If you were talking to someone in an office, in a clinical office, and they said, I'm worried about this coronavirus, what would be some of the key things that you would tell them in regard to this virus that we keep hearing about over and over again?
That depends on what their concern is about. If they had symptoms and they had a recent travel to China, then immediately the next step I would do is offer them a mask and take them to a separate room and have airborne contact precautions and droplet precautions. If that's not the case, and if it's somebody who's living in Missouri and never had this travel risk, or if they have not had a contact with somebody who's been ill or who has traveled to China, then I would reassure them and I would test them for the flu if they had symptoms. If not, reassure and educate them that they don't have to be worried about coronavirus. If they needed details, then I would provide details about what's going on and what should they be concerned about.
How well can those in Mid-Missouri test for this virus?
The testing is limited to the laboratories with the CDC. So right now, institutions don't have. It is FDA approved only to be done within the CDC premises or within the state health laboratory premises. So as soon as we have a suspected case, what we do is we notify our infection control, and they will, through infection control, we will get the amenities for proper testing. And what it involves is having a swab, a nasopharyngeal swab, in patients who are suspected. The first step is evaluation of their symptoms to see if they qualify for a person under investigation. And then those amenities are provided by the state health laboratory. And if the person is truly suspected to have this disease, then we will go ahead and test them as well as quarantine them or move them to a safe place so that we can avoid the spread of the suspected coronavirus disease.
So would this show up as something that you are unfamiliar with, and then you would take the steps that you just outlined? I don't know how you can say, not you, I don't know how anybody can say, well, it's something we haven't seen before. Maybe this is a new virus, but it is the coronavirus, and making that leap to saying that it's that instead of something else.
Right now, the only clues are, one of the main clues is the epidemiologic link as a travel or to the sick person. Without that, the symptoms are no different than many of the respiratory viruses. And it has come in a season where flu is very rampant. So it's impossible to just differentiate based on the symptoms alone at this point. The disease is being learned as the number of cases increase, the number of studies that are being published is increased. So far, there has not been much of a difference between how the other respiratory virus is present as against the coronavirus.
I read something today that I think is a good sign, and that is the World Health Organization is going to be invited into China. I guess China has been pretty protective up to the last few hours or days, and this is an important step. Could you help us understand why that it matters that WHO gets a chance to go in and study what's happening there?
Exactly. So far, I should say the steps that the Chinese government has taken, the advances in disseminating the genetic sequence of this particular virus, those steps taken by China are phenomenal. We can see that within a month they released it to the entire world, and the CDC prepared PCR testing within a week. The advancements, as well as the steps taken, they're pretty phenomenal. Now, the reason WHO is stepping in is the number of deaths that has happened as a result of the coronavirus has reached it's still about 2.2% considering the total number of cases that have been diagnosed. But overall, it has the potential to reach pandemic proportions. When it has the potential to reach a pandemic proportions, then we have to work together. So that's one of the reasons that WHO is stepping in to see, because our CDC officials in China are also working along with a lot of other countries' healthcare professionals as well. So I think to quickly disseminate information and to work on possible treatments, vaccine developments, it's important that we collaborate, and that is why the WHO is stepping in.
It's interesting because I like the statistic that you gave a moment ago, because it helps us put something in perspective, and that is, you said, like I think it's something like 2.2% of those who are known to have the coronavirus have died from that. What is the flu percentage? Do you have that number?
Sure. The flu deaths and the number of cases, the number of people tested, the number of people who are, it's released on a weekly basis. And the week counts are starting from January 1st is week 1, week 2, week 3, week 4. So as of now, as of week 4, the total number of deaths as against the tested positive cases, the percent is 7.1%.
Wow.
And if it goes higher than 7.2%, then it's epidemic proportions. But so far we've stayed below the epidemic cutoff of 7.2, fortunately. But every week, as somewhere, I would say 200 to 350 patients is the number of cases that we see per state. And then in per country, you can imagine how many cases happen. So the impact of flu is significant at this time of the season, which is when the cases usually peak. So right now, it's unfortunate that the coronavirus outbreak happened coincidental with the influenza season. So it's important for us to still think about and bring flu to the number one suspicion, because early treatment and getting attention early, especially those with cardiac disease, underlying lung disease, or immunocompromised, they're at very high risk of severe manifestations and death.
Yeah, wow.
So I think that
number of 7.1% of those who have been diagnosed with the case of influenza pass away, compared to 2% of those so far who have been confirmed and diagnosed with coronavirus. It gives you an idea of what we hear oftentimes, and that is the flu is something we should be, at least at this stage, more concerned with than the coronavirus. But let me ask you this before I let you go, Doctor, and that is from a spectrum of I don't care, I'm not concerned about it, I'm not paying attention to it, to be very concerned about it and changing your life because of this fear that sometimes the media ramps up about something like coronavirus. Where do you think we should be on that spectrum?
At this point, I think it's still important for us to evaluate ourselves. Did I have a possible link to somebody from travel? And that is all the most important question that we should ask. And if we really don't think that has happened, then I think we should allay our fear about the coronavirus and rather think more about I should go get tested for flu.
Very good. We'll let it go at that. We hope that it's not something that we need to revisit, but we'll watch and see. One of the things that I saw in an article today was that at least for a moment, it seems like the number of those who have been found with the coronavirus in China has started to taper off, or at least level off. But that doesn't mean that they're out of the woods there yet, because maybe it just means that there's a lull in the diagnosis of that. But it's something that I think education is key, and you've educated us this morning. Thank you so much.
You are welcome. Have a good day, David.
You too. Thank you. He is an infectious disease expert at MU Healthcare, Dr. Hariharan Regunath, who's been our guest. You're listening to Columbia Morning at KFRU.